I am going to show you how continued with the planning of this case. As you had seen, this was the case that was in MIC. And that then we looked at it as it was in CR, and finally as the case is placed in the advantageous position that gives us the surgery. Here we can see exactly how the sequence we followed together with Dr. Cristobal. This is the case without surgery yet. Here is the initial filling. Then there is the surgery planned by Dr. Cristobal with a bilateral advancement osteotomy for the mandible, plus chin and maxillary impaction, so that finally the occlusion is as it is in this last image. And this last image of the occlusion is the one I'm going to use to simulate the treatment. Already something similar to what we had seen in this image here. Well then, in this position where we have already seen where our teeth are going to be in our surgery, now it is in this situation where I am going to generate the movement of the teeth to decide several things. I want to decide whether we do extractions or we don't do extractions. I want to decide how much expansion I want to give to this case as well. So basically what I'm going to do is to move the teeth in this aligner software, which allows me to generate the changes I want. So here is simulated the expansion, and it is simulated on the right side the distalization that I would have to do to be able to solve the alignment. And on the left side, what I did was to simulate the exodontic, simulate the exodontia of the first premolar, to see how much I have to lose anchorage in the posterior sector and retrude in the anterior sector. We more or less see the same thing. We visualize it in this part. Why am I interested in seeing the part of how much the teeth move? It is because this is going to help me to know, for example, that the upper right first molar has a movement of 3.8 millimeters to achieve its expansion, and the same on the other side has also 3.18 millimeters, which means that is about 7 to 8 millimeters of expansion that I need to be able to get this case. Then I have closed the spaces with minimal anchorage of the posterior sector, and I am left with these spaces as a result of the dental discrepancy. It has tiny little centrals, which we should also correct, which should also be corrected at the end of the treatment. So we have also expressed it that way. Improving with the virtual teeth of the program how should be the ideal shape of these teeth. Finally, the treatment protocol that we are going to follow is going to be, in the first place, an expansion of approximately 7 millimeters of the maxilla. Then a stage of aligners for minimal upper anchorage and exodontia in the lower sector, so that we can finally perform the orthodontic surgery. Orthognatic surgery with this advantage that you are visualizing in this area. And that is the plan we want to follow. Let me know what you think, what else you would think of doing, or what else you can comment about this case. We'll see you.